Hi, everyone, and welcome back live to this LinkedIn Live episode of Know Your Data, the Data Literacy Project series where we help you make sense of all the data, charts, and terms that we see every day about coronavirus. I'm Kevin Hanegan, the Chief Learning Officer of Qlik, and I'm pleased to be joined by Chantilly Jaggernauth, the founder of Millennials in Data, the Vice President of Data Visualizations for Lovelytics, and of course, a member of the Data Literacy Project's advisory board. So today we're going to be talking about something we hear more and more about, and that's contact tracing. How does tracing generate the data that goes into decisions that are incredibly important? As the Dean of Rutgers School of Public Health put it, contact tracing is one of the few tools we actually have in the absence of a vaccine. So before we get into it, we're just going to give a high-level overview of the three parts of the episode we're going to cover today. The process of contact tracing, what that means from a data perspective, and how we can use it going forward. So contact tracing isn't quite a hardcore data term. In fact, instead of using it to look into the future, we're actually using it to look backwards. So when one person is found to have the coronavirus, we need to go back, see who they may have transmitted it to the past several days, and try to get those people isolated before they spread it themselves. We use this as we're now entering a phase of reopening. So what does that mean with the data and the numbers? Well, instead of 90 people staying home whether they have the virus or not during the social distancing, we're now letting everyone come into contact with higher numbers as we walk around more during reopening. So we're rolling the dice more and possibly transmitting the virus, which, all things being equal, get more people infected overall. This will have a great effect on the rate of transmission and the reproduction number, the R number, that we've talked about in previous episodes. And this will help us influence and interpret the data we're seeing moving forward. And then going forward, what we've talked about is by far the most important part of contact tracing for coronavirus. But it can be more than just working on individual cases. Patterns can form in communities or states or other regions over a longer time period, like a month or so. And if we pan back on all this information and data, it might be possible for the little pixels from contact tracing to form larger, at least fuzzy pictures of how the virus is spreading more generally as we try to open up as a society. So remember, this is a live episode, so if you have questions, submit them to us through the live comments section. We'll try to answer them sporadically through the episode. And also, as a reminder, this show is about data. We're not really here to talk about public policy, but more to help you understand the data and how it can help you. So with that, I'm going to hand it over to Chantilly to explain a little more in detail about how contact tracing works.
Awesome. Thank you so much, Kevin. Really glad to be here. All right. So before we get to the actual data, I just want to say how contact tracing works. When a person tests positive, contact tracers ask who they've had meaningful contact with over the past several days. Because during that time period, the person was almost certainly infectious, but just didn't know it yet. When I say meaningful, in a math sense, that means that they've had enough contact that there's a high probability the virus was transmitted. We can't contact every single person they breezed past on a street corner, obviously. We just want to focus on the people that they were in the same room with or picnic with, things like that. Let's look at this in action and watch what happens. Kevin, I'm sorry, but you're about to get the coronavirus.
Oh, anything for data literacy, I guess. So it's okay.
All right. So let's say our friend Kevin gets tested and finds out on Wednesday that he has the virus. Because he's a good citizen, he immediately isolates himself so he doesn't risk infecting other people. But he might have infected other people already. For the last 3 or more days, his personal incubation period, he could have passed the virus on to other people, and they didn't know it. They just don't know it yet. We want to find those people and first get them tested and isolated too. This can have huge effects on the data. So let's watch it in action. Kevin tells the contact tracer that he had meaningful contact with 8 people. Laura, Teddy, and Mark yesterday, Matt, Susie, and Kelly on Monday, and Bonnie and Clyde on Sunday. We contact those people and they offer to get tested. 3 of them test positive, Mark, Matt, and Bonnie. So now we can immediately isolate those three people. We want to keep them from infecting other people. Now let's watch what might have happened without this isolation. Had Mark, Matt, and Bonnie kept walking around, Bonnie would have infected one person on Thursday, and Mark might have infected someone on Friday. But now they don't. Those nameless people disappear. Success. Contact tracing from Kevin couldn't help Mark, Matt, and Bonnie because it was too late. But now we've kept 2 more people from getting it. But maybe we can do more. We know that Mark, Matt, and Bonnie also had their own connections since getting it from Kevin, but just not knowing it yet. Hopefully it's not many, but let's investigate if we can. Matt tells us the people he had contact with. We test them, and lo and behold, he passed it along on Wednesday to his friend Lizzie. And Bonnie, we test her contacts, and we discover she passed it on to her friend Samantha. Lizzie and Samantha didn't know, but now they can isolate 2, stop running around, and maybe infecting 1 or 2 other people. Every person you find helps you keep these trees from growing. If you look at it like this, we've already saved 4 people from getting infected just from contact tracing Kevin and a few of his contacts. Now, I have to tell you that the numbers aren't this high in real life, but you get the idea.
Thanks, Chantilly. So actually a good time to pause and try to answer some live questions. So we have a question coming in from Susie. And Susie asks, is the speed of the testing important for the accuracy of the data?
Absolutely. The sooner your meaningful contacts can be traced, then the quicker they can isolate and possibly keep from infecting someone else as well. In our example, Kevin was in contact with 8 people, and unfortunately 3 people became infected. Because Kevin acted quickly, we were able to keep those 3 people from infecting 4 more. We were able to identify Kevin as the possible source of the virus that infected them. Had Kevin waited any longer, those individuals could have possibly infected other people and not have known it yet. In short, the sooner contact tracing can be enacted, then the better the data and the higher the chance of not spreading the virus.
Great. Thanks, Chantilly. We have another question coming in from John that I'll field. So John says, what do you think about the values of herd immunity that also come from reopening? So really good question, John. In one of our future episodes, we'll actually be talking about herd immunity in great detail, and I'll provide those details at the end of this episode. But herd immunity ties in really nicely to the R, the reproduction number, the rate of transmission. And just at a high level, if the R is 1, the disease is said to be stable. It's not spreading, but it's not decreasing. As you get that R number below 1, the disease dies out. The lower the R number, the quicker it dies out. This is, of course, assuming that there's no vaccine or cure or large population that's already immune to the disease. So when you're calculating herd immunity, take into account that there isn't a vaccine yet or natural immunity to it or treatment. What we need to calculate is what can we do to get the R number below 1, and how many people need to be already immune from having the disease and recovered to get to that point. And it's at that point that we'll have herd immunity. But we'll cover that in a lot more detail in the next episode, where the whole topic is herd immunity. One more question, and we'll go back into some of the presentation. So Simran asks, how does the R number tie into contact tracing? And I think this is actually a perfect tie-in, because this is exactly the next topic we're going to be talking about. So I'll answer this, and then we'll go right back into the presentation and see a visual example of it. What we're using is the R number as a point-in-time reference. There is an R number, which is effectively the contagiousness or the rate of transmission of a disease overall. But we're looking at in points in time and locations, which means in this point in time, in this location, with all the effects we're taking with social distancing and wearing masks and contact tracing, we're trying to get that R number as low as possible. So the R number in that point in time for that region is helping us understand if we're effectively improving on it by using contact tracing. And we'll actually go in right now to a visual example. Keep the questions coming, though. We have plenty of time to answer some of them. It's a perfect tie-in to go back to this example that Chantilly started. So with that, we'll go back to the slides. And remember that I had already infected 3 people. But by doing this contact tracing, I was able to keep those 3 people who were infected from infecting 4 more people, if you remember from Chantilly's example. So for those 3 people, by keeping them from infecting people, because we notified them and said, you had meaningful contact with someone who's tested positive, we're going to isolate you, we've been able to bring their individual R numbers down. And we want to do this as much as possible so all of those individual R numbers can combine at an aggregate level to help decrease the big state or region or countrywide R numbers that everyone's looking at in the news. And let's take a look at the impact of R as we use this example with contact tracing. So let's assume the R value was 0.8, the green line you see on the screen, before reopening. This means for each 100 people that have the virus, they will go on and infect 80 more people. When we went from social distancing to a phased reopening approach, let's assume that that was going to make the R number now go to 0.9. We're now going to, for each 100 people with the virus over the same time period, they're going to infect 90 people. And we want to keep the R number low. So we introduce contact tracing, as Chantilly mentioned, and let's assume that takes it all the way down to 0.7. So you can see on the screen the difference between the brownish line of 0.9 and the blue line of 0.7. That's a massive difference in total cases over the next several weeks. It's just a highlighted example. It could be a little bit embellished, but you can see the big differences: 35 cases with an R of 0.9, 3 cases with a 0.7. To put it into perspective, here's how a contact tracer in the state of Colorado actually put it. The number of contacts is likely to increase now that people are interacting outside their homes more, because we're going more to a reopening phase. We're not expecting to get 0 cases and stomp out the virus. We do expect it to be at this low level, and that's where we're wanting to keep it. So to come back to your answer, Simran, your question, we are using the R number to monitor the impact of what contact tracing is doing on the spread of the transmission. So we do have one other question coming in, and then we'll come back to the presentation. So Daniel asked, do different states have different contact tracing methods? I'm happy to field this one. So the approach that we're talking about is highlighting people who have been infected and listing out people they had meaningful contact with over the previous periods and notifying them. That is a standard, but there are different regions and countries that perform contact tracing either more hardcore or less core. So for example, there's a lot of countries in East Asia that have digitized the approach, and they have applications that allow you to do the contact tracing, where there are other states within US that might have a more brute force approach, where you go to a restaurant and you fill your name out on a sign-in sheet and they can contact you that way. So the approach is the same for coronavirus. We will talk about at the end other methods of using contact tracing beyond just trying to lower the R number, but it is up to the region and the states and the countries for how they may decide to implement it. So now, actually, I have a question for you, Chantilly. So going back to our example, when I tested positive with the coronavirus on that day, we tested 8 people that I had meaningful contact with, and 3 of them came back positive. But we don't only isolate those 3 positives that I infected, right? From what I understand, we also asked those other 5 people who originally tested negative to isolate too, just in case.
Correct, Kevin. The reason we also asked the other 5 people to isolate is because there's about a 20% chance that someone can test false negative. And this was the case with Teddy. Teddy wouldn't have known his symptoms until they appeared on Sunday. So isolating him from Wednesday through Sunday keeps him from infecting Noah on Friday and Paul on Saturday. So now, instead of contact tracing with you to avoid 4 more infections, it's actually 6, which is even better.
Yeah, thanks. And perfect transition back to a couple of questions. So Anandakumar has asked, is contact tracing possible from large retail store environments and salespeople? I'm happy to take it, Chantilly, or if you want to take it, be my guest.
You can go ahead, Kevin.
Yeah, it's a good question. So I mentioned my example. I went out to dinner we had opened in my state a couple of weeks ago, and the approach of contact tracing there was from where I was, we signed in a sheet that this is who we are, this is our phone number, And then if someone from that restaurant had tested positive during that time frame or around that time frame, contact tracers would get that list and then notify me back. So to answer your question more specifically, I guess it depends on how that large retail store does things. If they want to identify everyone that's walking through the door, like our restaurant did, or some countries we mentioned in Asia that have the digital applications that might even use GPS. So there's a whole range from sign-in sheets to using GPS on a mobile phone and everything in between. So I would say it's a lot harder to do it in a retail store, a massive store, because you're stopping people before they come in. But it is absolutely possible. Let's go ahead and take a look at a few other questions that have come in. So Amelia has asked, what patterns does contact tracing allow you to see? Because I'm going to be talking about patterns next. I'm happy to take this one, Chantilly. So we've already talked about contact tracing allows us to lower the transmission rate, find people who are infected, find people they had meaningful contact with over the past few days, and tell them to isolate. And as Chantilly mentioned, even if they don't test positive, we still want to ask them to isolate because it could be a false negative. The other value of getting all of this data is moving forward, we can understand patterns and trends of where there may be outbreaks and then do a root cause analysis. So for example, let's say we do all of our contact tracing and looking at the data and putting it together, we see that there is a big outbreak in a shopping center or in a specific sporting event or venue. Then we can go forward and take a look at those places and try to understand more, why was that transmission higher than in other areas? Was it because their cleaning guidelines are not up to par, or was it because people were not wearing masks, or was it because something else? So those patterns allow us to see those areas of higher transmissions and do more of a root cause. It's not allowing us to go back and reduce the R number backwards, but it's allowing us to try to get a better handle on what's happening in those areas and put some interventions in place to hopefully improve on lowering that transmission going forward. So still send in, we have plenty of time for questions. I'm going to go into the next section and we'll come back and answer a few questions. So the third part of the presentation was around the perfect lead-in from that last question. What are we using contact tracing for going forward? Why is this important to our communities as a whole? It's because what we can do is we can take all this individual data that we've collected and we can identify some patterns and trends. For example, maybe we see that in week 1 of contact tracing, most people were infecting 2 people on average. But on week 4, a new batch of people are infecting 4 people on average. That's double the infections. Is this happening because these people are not social distancing as they're supposed to? Maybe they're not wearing masks. Or, as the example I just gave, do a disproportionate number of people in transmissions appear to be coming from people visiting the same locations, like a shopping mall or a party. This would suggest that social distancing there is not up to par. Maybe it's not being disinfected. Maybe people aren't wearing masks. So this allows us to look at these patterns, which in the line of sight, when they're coming in, they're really hard to detect. But when you aggregate them with all the data we're getting from contact tracing, it can be really valuable to identify these places and ideally figure out interventions moving forward. And that's really fascinating as we move forward. So good question coming in from Joe. What are some more unknown but perhaps better visualizations for displaying contact tracing data? We've seen geospatial views, but anything else? Again, Chantilly, I'm happy to take it, or if you want to field this one, be my guest.
You can go ahead, Kevin. I think the only thing that I'm familiar with is the geospatial one and the cluster. So if you have anything, go ahead.
Yeah, obviously, thanks, Chantilly, and good question, Joe. The example that we were just talking about, trying to identify patterns in transmissions from geographical areas like shopping malls, those would obviously be maps and geospatial applications. But when you're looking at contact tracing, remember, you're actually going backwards. So what you could potentially use is a map that's almost like a node network graph, where you have the person that's been infected, like you see on the previous slides, being able to work backwards to see who they had contact with, who they've been infected from, and you're able to spot things like potential super spreaders, someone who maybe was at a party and spread it to 10 or 15 or 20 different people. That's one way that we can identify the R number and the spread of those patterns, is kind of the network node-based graph. Specific to the R number, we tend to use, it's over time and place, so we tend to use line graphs. But I've seen a lot of research papers that are doing contact tracing and highlighting how it's done, where they're using the hierarchy, almost like an organization chart node, like we see on the screen here. So I'm looking over a few more questions to see how they come in. And as we give you a little bit more time to ask any questions that come in, here we got one. So a LinkedIn user says, what is the most common period of time the government used the R number for? For example, the R number during the last week can be different from the R number during the last month. And since I've covered the R in the previous episode, I'm happy to take that. It's a really good point. If you think of the R number as potentially two different things, there's the innate transmission ability of the disease. That is the R number without any interventions, without any vaccines, without any treatments. And then the R number that we're looking at on the news is more of, as the LinkedIn user says, it's more of a point in time. It changes as we apply different interventions. So in a previous episode, we were showing the R value over 1 when we were trying to flatten the curve. And as we put in things like social distancing and sending kids home from school and then wearing masks, we were able to see the R numbers going down. So I think, I can't speak for every government, but I think to answer the question, the R number is being used to validate how our policies are against the disease spread are working. So as we social distance, we look at the R to see the number go down. As we start entering a phased reopening, we want to start looking at the R number. We know it's going to go up a little bit, but we want to try to keep it down. As we see it going up, like we're seeing in certain states in America and certain countries, then that's an indication for the government that we got to maybe take a step back and introduce other interventions. So it's being used to affect how we're going to apply interventions for the disease. And I'm not making statements on policy again, but that is how we're seeing it applied in different countries and states to use as that point in time. It is not a number that exists forever. It changes based off of the interventions that we apply. So question from Giselle. Giselle asked, the contact tracing overall cannot truly reach the exact number of those infected, correct? Question mark, correct. Chantilly, feel free to take that one.
I can take that. So it says the contact tracing overall cannot truly reach the exact number of those infected, correct? No, and this gets me back to the point of meaningful contact, right? So with contact tracing, the contact tracer is going to ask you who you've had meaningful contact with. And that's the benefit of contact tracing, is that we can get in contact with the individuals that you were in the same room with, or that you were maybe at a party with, and start to understand who you may have spread the virus to, and get them to self-isolate. So no, it's never going to be perfect. It's not going to get you down to the right number of how many of the individuals that you've infected. But what it is going to allow those individuals to start to self-isolate in case they may have contracted it from you and could potentially have the virus. It's going to keep them from potentially spreading the virus to other people.
Thanks, Chantilly. Great answer. Still a few more minutes for live questions. I'm going to go into the summary slide and talk a little bit about a recap of what we learned, and we'll see if any other questions come in. So the 3 takeaways from this episode, again, relate to the process of contact tracing, the numbers and the data that we get from it, and how we can use it going forward. So as a reminder, contact tracing, as we're using it for the coronavirus, is designed to find people who might have been infected, not moving forward, but working backwards. We find people that are infected, we identify who they've had meaningful contact with, we notify them, get them tested, and have them isolate. Whether they test positive or negative, as Chantilly mentioned, there is the opportunity that there's a false negative, and we don't want them spreading it when they don't have symptoms. It goes without saying that if someone had symptoms and they think they have the disease, we're not saying they're going to go out and spread it. But because coronavirus does have a stage where they're asymptomatic, yet they can infect other people, that's the importance of getting to contact tracing as soon as possible. The data that we get and the numbers we get from contact tracing will allow states and countries and other governments to affect their reopening strategy. And they're going to use the R number for this. So the R number, the reproductive number, tracing helps us determine who had contact with an infected person so we can isolate them. And that's going to help keep the R number down because, as I mentioned, we're going to isolate them. They're not going to be out when they're infected, but potentially don't have symptoms infecting other people. And another use of tracing going forward, although it's not the most important one as it relates to coronavirus, is taking all of the data that we gather from contact tracing and looking at any trends or patterns that could be insightful. So we went through a couple examples where we see an increase in transmissions in a specific geolocation, and we would then do a root cause, drill in, and understand why that's happening and try to put interventions in place to remediate that, whether it be greater social distancing guidelines or guidelines for wearing masks or better cleaning protocols and similar. So we're right about the time. I do, Chantilly, want to thank you for coming on and talking about this. And I think it was a great episode in terms of educating people on how we're using contact tracing, why it's important, and what it means to what we're seeing happening in the news every day.
Awesome. Thank you so much for having me.
Absolutely. And thanks everyone for joining. If there were questions that we didn't get to, we will follow up with these, but we do look forward to seeing you on the next episode, which I teased in the beginning, where we're going to cover herd immunity. And there were a couple of questions coming in around herd immunity and the relationship to the R number and the relationship to contact tracing. So don't miss that one. It is on Tuesday, July 28th at 11 a.m. Eastern time. Until then, if you have any other questions or other topics you want to bring up, you see all of our social handles and addresses on the screen here. For Chantilly, for the Data Literacy Project, for Qlik, I want to thank you for attending this LinkedIn Live episode. Hopefully everyone was able to take away some new knowledge and learning from it. Have a great rest of the day, and we look forward to seeing you on July 28th. Thank you.